Welcome to Beyond Sprint, the podcast where I reconnect with inspiring entrepreneurs I have worked with. I'm your host, Karlis, and today I'm joined by Irina Ghazaryan, co-founder and CEO of Dr. Yan, a leading doctor-patient platform in Armenia that is expanding to new markets. I first met Irina in the plug-and-play Armenia Accelerator program back in December 2024. In this episode, we dive into Irina's transition from architecture to UX design, founding and leading Dr. Yan, and her experience in the plug-and-play accelerator. Let's get into it. Welcome to Beyond Sprint, Irina.
Hi, Karlis. Thank you for inviting me.
Where does the podcast find you?
I'm in Yerevan, in Dr. Yan's office.
Let's dive right in, and maybe you could start out by sharing a little bit about yourself and about Dr. Yan to the listeners.
Sure. So I'm co-founder and CEO of Dr. Yan, which is a patient doctor marketplace. Everyone keeps asking me, are you a doctor? Well, I'll start from there. I'm not a doctor. I'm coming from a family of doctors, but I did my bachelor's degree and later a master's degree in architecture and urban planning. But at some point, I moved into product design and UX design. I started building products, mostly for companies based in US and Europe. And at some point, I decided to get back to working on a product from my own country, Armenia, and connecting the dots with my family heritage, with experience that my family is holding, and my experience with creating and building products. Eventually, I built Dr. Yan with my amazing co-founder. So right now, we are based in Armenia. We are the leading doctor-patient, I would say, appointment booking connection platform in Armenia, and we are gearing up to entering new markets.
Wow. I loved the way how you summarized it because I think this summary kind of gives the agenda of how I planned the conversation. So you started by sharing out your roots in architecture and then finishing up with this point on expanding beyond Armenia. So maybe let's start from the beginnings. You mentioned architecture, and as I was preparing for our conversation, I was really amazed that you hold a master's in architecture, but at the end of the day, you had the shift and you moved for UX and UI. And although, for example, my background, I used to work as a UX architect, but architecture and UX, so those are completely
Yeah,
different
that
two
sounds
worlds.
fun. Yeah.
So maybe you wanted to tell a bit more. How did this shift happen from architecture to UX UI in your life?
Yes. Well, I started as an architect and I was working in a company here in architecture studio, and I was mostly doing residential buildings, apartments, and interior design. Then I realized that my core interest is beyond that scale. It's more about urban planning, how we structure cities, how we structure regions, etc. And I had somewhere around 4 or 5 years already of experience in working, and then I became a mom. And it was prior COVID, before COVID, and at that time it was not a very common thing to work from home. So it was really very difficult to find a job, work from home, and maintain the quality of your work while you're a stay-at-home mom. So I decided to and my first thought was well, while I'm at home, let me learn something new. And I started learning UX design. It was quite straightforward after complex architectural drawings. And, and I loved it because I loved how quick you can implement something and immediately have an impact. Like you build a mobile app and in 2-3 months you can impact thousands of people immediately. And I became very passionate about it. I ended up working in a company, a US-based company that was doing remote patient monitoring. I was very lucky to work in a group of amazing people. And I figured out how we can improve patients' experience with necessary tools, not very complex, not like, something that is like running on hundreds of different complex processes, but with quite simple processes you can really improve, especially for patients who have chronic diseases. They need like long-term solutions. And during that time, I started realizing that there is a ton of work to do in Armenia. Like at that moment, there was no particular solution to book an appointment without calling the hospital, calling the doctor. So you were guaranteed you're going to wait in at least for 1 2 hours in line when you go to hospital. So I thought, why not? Maybe we can improve this with my knowledge of creating products, with my family's knowledge of how the healthcare actually works. And the missing component was the technical part, like how you actually build it. So I found my co-founder Zaven, who is also our CTO.
You also mentioned the origins of Dr. Yan in terms of your experience in UX with this US based company. And also your family background. What exactly sparked that inspiration to jump into complete unknown and starting your own venture?
Yes, I love this story because it's absolutely true. And sometimes people come up with ideas like how they started creating a platform or something, startup. But this is like 100% true story that since my work was in US company, and there is 12-hour difference between Yerevan and Los Angeles, and I was working mostly at night. And one day I was working like it was 1 2 a.m. in the morning, and my father was still receiving phone calls as a doctor. And I was like looking at him and I was like, can we do anything so that you stop receiving phone calls at 2 a.m. in the morning? And he said, yes, if there was something that I could just like turn on my phone, but know that patients still can book an appointment. And that was like, well, we should do that. And I always had this feeling that I'm contributing to a patients who live in US, but I'm not in any way contributing to Armenians who live in Armenia. So it was a kind of a dream came true when I started working on it.
The problem for successful entrepreneurs originates something from their personal lives. Like there is a personal challenge or related to
Yes.
you as a person.
Yeah, and you just notice it, and you can actually eventually you can ignore it, like, well, there is a problem there. But sometimes the problem is so relevant and the solution is so clear in your head that you can't just help yourself. You just want to jump into it.
I also noticed the number, I think either on your website or LinkedIn, that you have 1,000 doctors on the platform. Maybe
Yeah.
you can share some insights and the challenges you have observed in onboarding and supporting doctors and using Dr. Yan.
Yes, for sure. There were many obstacles, starting from like the basic things, starting from subscription model, because Armenians are not very much used to using subscription-based platforms. Like we are much into result-driven payment. Like, for example, you have, I don't know, use this amount of resources, you pay for it. You're not paying in advance. And at first it was hard for us, but then I guess our doctors got used to it. But the problem there was that uh, you can like put all the doctors into one basket and say like you're all doctors. But when you actually start observing them, you understand that they are also all very different. They're different based on their like occupancy, like is that a surgeon, is that a dentist, etc. They're very different based on their daily operations, and also they're very different based on, I would say, on their patient base. So you cannot compare, you cannot put in the same basket doctor who is just starting, like they just graduated, they are just started, they don't have many patients, and the doctor who has like 30 years of experience, they have many, many patients. These two people have absolutely different problems, even though they are both doctors. And we started segmenting them, and we started changing our subscription model based on each of their needs, because there is like one example that highlights how it works actually. If you go to a doctor who has like hundreds of patients and you tell them like register to our platform and you will get more patients, he will at least get frustrated, like I don't need more patients, I don't know what how to organize all of these patients. And if you go to a doctor who don't have enough patients and you tell them like I will help you to organize your schedule, they'll be like, it's irrelevant because I don't have that many patients to organize my schedule. So these are very different offerings, and it took some time for us to realize like how to customize each subscription type, but eventually, yeah, we got there.
You kind of mentioned two main groups. I'm a young doctor with not that many patients, and I'd like to get some more traction. And then there's the group of more experienced doctors that have their patient base. Maybe you can share a bit more, like what have been your subscription strategies here with these two groups?
Mm-hmm. On a high level, they are that we have four types of subscriptions. It's 3 months, 6 months, and 1 year, like yearly one. And there is a completely separate one that is for like super occupied, super busy doctors. That's completely separate. But for those 3 months, 6 months, and 1 year subscription, so we did it this way. So if you're just registering to Dr. Jan as a doctor and you want to see results immediately, like you just want immediately to gain traction, to get more patients, to be visible, etc., you better purchase the 3 months plan, which is a little bit pricey, but we help you with marketing, we help you with visibility, with appointments, with getting real feedback, all those things. If you already like tested out Doctrine and you love it, you better choose 6 months or 1 year subscription, which is cheaper, but we're not very much helping you with marketing. We just give you all the necessary tools and you do it on your own. And the last subscription, if you don't want to answer any phone calls, if you don't want like to do anything with routine organizing, scheduling, you just outsource it to us. We do all the things. We keep in contact with your patients. We help you with scheduling of everything, and it's the most pricey plan. But doctors who are using it are like, they always tells me, you are doing much more than I'm paying you. But these are the doctors that are actually they are the driving force beyond Dr. Young, because they bring so many patients into our platform that otherwise would be very costly for us to get.
I'm also happy to hear that you are exploring already different ways how to monetize the platform with the theme-based model as well. But let's get to a bit more of a recent past. That was plug and play Accelerator program in Armenia.
Yes.
That's where we met. And you also recently finished the program. That was back in February, right?
Yes.
Congrats on that. I'm super happy for you and the team. So, as many entrepreneurs will be listening this, maybe you want to share what kind of an impact the program had on you as a founder and Dr. Yan as such.
Mm-hmm. Well, I was very happy to be part of Plug and Play. It was really something that I was very much looking forward, and once I heard they are coming to Armenia, I immediately applied. First thing that comes to my mind is that as an entrepreneur, as a startup CEO, you are all the time very deeply focused in your startup on a very detailed level. Like every day you have so many tasks that you need to accomplish. Like you're thinking about your customers, you're thinking about your employees, all those things. And Plug and Play gave me the opportunity to, like 3 times a week, to just zoom out from my daily tasks, to look at it and think like, well, we're doing this wrong, or we're doing this good, and we should focus here more. And that's actually, I would say it's a big opportunity, because you can zoom out, and then every week you have mentors with whom you can discuss all those things. Because it's not always, you don't always have this like opportunity to discuss your startup with people who have much more experience than you do, especially in like smaller scale countries. And we had people, I think, almost all over the world, like from Europe, from EMEA region, from Indonesia, from US, like many different countries, and they all have their own perspective and their own experience. And yes, sometimes that may not help you. Like sometimes the feedback might not be very relevant or it might not help you, but you still gain a lot of knowledge of how actually different people can see your product, comment on it, and help you. I always recommend everyone I talk to get into plug and play. Firstly, it's a huge network, many opportunities. I mean, the team helped me with almost everything I asked for. Like, can you help me with this? Sure thing. And then you get 3-4 people who are working on something you asked for. I mean, that's amazing.
Yeah, I think Eleanor and Alfredo, they're amazing
Yes.
in supporting the teams, and also the mentors that I met. Completely agree with you in terms of that perspective that they can bring. From what you shared, I hear there are two main things then what you're taking away from the program. So one is this weekly zoom out from those operational tasks, and that you have the chance to speak with mentors who ask more like higher level questions and support you there, and that was one thing. And then the other, the network that you get the access to as a part of joining the program.
Yes, absolutely. So we have workshops 3 times a week and we have mentorship sessions. The workshops are very different for you. Depends on your on your experience and your knowledge on that exact topic. But the mentorships, they are much like to the point, and I would say that I very much enjoyed mentorships because I got some feedback that I got some advices that would never cross my mind. I think like they haven't crossed my mind before that moment. It's like, have you tried doing this thing, and then you realize that you've been working on this product for 3 years, and somehow you never thought of it, and that's really cool. Yeah.
Okay. When I joined, so that was in the week before Christmas. Our discussion there was about how to not to make the app of Dr. Yan too complex, given the different types of appointments the patient can choose from. So, and there we kind of mapped out the journey. Maybe you can share a bit more. Where have you ended up with that?
Yes, so we are right now redesigning the app fully. We'll probably build it from scratch in different development. Like we decided to move it into Flutter and build it from scratch. And we realized that very well remember our conversation. My main point was that we're adding in-home visits, we're adding online consultations, we're adding hospital visits, and how to not to make the app too complex, but to make them actually use it, like find what they're looking for. And the outcome of the conversation was that eventually I just want them to book an appointment. Like that is the main thing I want them to do. Later on, I'll give them an opportunity to decide whether it's in-house, whether it's online, whether it's in hospital. And since right now many of our doctors, they decided to jump in for this online consultation thing, like probably almost all of them have this, feature on their profiles. The redesigning went really smooth because I immediately knew what I want them to see on the homepage. And it's sometimes very complex because right now, if you go to any marketplace, the food delivery, I don't know, kind of Amazon shops, etc., the home screens are so busy, like you eventually get lost. And you can maybe afford it if you're Amazon, like you have so many products and people regularly use it, but you cannot afford it when you are something about healthcare and people want clear actions. They don't want they're not going to book an appointment at dentist, but also buy I don't know, the OB/GYN consultation. They only want a dentist visit. And so we're trying to keep it as clean, as neat as possible, but to help them to find anything they want in the app. I will share the new designs, I think, so maybe in 2-3 weeks. Yeah.
Okay. Wow. Yeah, I think the bar is quite high in terms of the experience we are all using. We kind of are expecting the same experience from all the solutions. I think
Exactly. Yeah.
um, there was this book. It's a classic in UX. It's Don't Make Me Think by Steve Kirk, I think.
Yes.
And one of the rules there was that well, he was describing is that most of the time users are using other solutions, meaning that
Yes.
I'm not setting the experience benchmarks, especially if I'm starting out, but what are the major patterns out there. And yeah, I think that's something
Yeah.
you summarize quite neatly in terms of Dr. Yan's experience. I, as a patient, want to book the appointment.
Yes.
Not like choose a type, or I just want the appointment to the dentist, as you said. But okay, going forward, I've been also following you on LinkedIn, and some of the posts that in the recent past that you have shared has been mentioning Notion. Also, you shared that for reflecting about Dr. Yan over the 2024, you used Notion. So, yeah, maybe you could tell a bit more. How are you using this tool as a founder and also within the organization?
Yeah, for sure. I love Notion. Like, I really much enjoy using it. And as a designer myself, I just, whenever I come across a really good, like, UX experience, I just can't, can't close it. And at first, I was using Notion for myself, like just keeping track of team, keeping track of all my tasks. Like I have even a personal board where I write down all the things that I need to accomplish within like my personal scope. But then 2 years ago, I had to write down our 2023 yearly like update, like what have we done so far, and I wanted to share it with our investors. And at first, I started like writing it down, and it became like a kind of a long text, because you actually want them to know that you went to expos, you had interviews, you gained users, you have new partnerships, like all those things. And then I realized that if, as an investor, I opened an email and it was like 3,000 words, I would just close it and never open it. So I thought, well, I need to send them a link. Like, just this is what we've done so far. We have this many users, this many doctors. If you want to learn more, just click here. And I found it that on Notion I can create like a public link, and I make it like a very clean version where I have like just the titles. Then you click on the title and you see everything underneath. So it's basically like chapters. And we had like numbers, partnerships, investments, expos, press, team, all those chapters. And I sent them it over on, I think, December 13th. And I thought like, oh, well, who is going to open it on December 13th? But that's okay. And I think in an hour, I got feedback from almost all our investors. And they were like, thank you so much. This is such a great format. Because, there's someone is interested only in numbers. But someone is also wondering how many expos did you go? Like, what was your visibility that year? And I realized it's a very good way, like, to send out things. And we started sending our sales deck this way. Like, these are all the things that we can help you to accomplish. If you're not interested in like call center services, you may be interested in more patients or things like that. And then our marketing team, we were looking for a software that can help us with like content planning and those things. And I wrote down in Google like content planning, and the first thing that came across was content planning template for Notion. And like, yes, we're using this one. And so yes, we are. I would say I'm using it for everything right now, but my team is mostly using it for sales decks, for content planning, for team buildings. Yeah.
Wow. Thanks for sharing the use cases. Um, I think we're living in an age where we are past PDF decks, whether that's
Yes.
pitch decks, sales deck attached to the email. I think the example you just described of preparing the report with sections that are by default closed, and if I'm interested, I can open. I think that's a nice way, given that different people are interested in different things, especially when it comes to investors, as you were sharing.
I think I forgot to mention, I'm also sharing our data room with Notion. And it's super easy to update, like you just quickly update on it, the link immediately gets saved. And I think there were some data room sharing softwares that were they were paying ones. And then there is Notion that is if you're on a free account plan, you can just use it. And I think so far I got good feedback on the structure of data room, how easy it is to use. So I also can recommend, instead of sharing a Google Drive link with all those things in it, I think startups can use Notion.
Yeah. Though I would probably also argue for the case of Google. I think they have done such a great job also with their Google Docs and having the tabs, so that you kind of can have one really huge folder within a Google Doc for example, for sales for a company, or also their app script that you can modify the Google Sheets. Pretty much you can create anything with the support of Gemini or ChatGPT, creating unique code. So, but I also agree with the case of Notion. I think that's a matter of synergy here for creating my super app without buying some fancy SaaS solutions there.
I think AppScript, on Google Doc, is something that was life-changing for me. I'm not a developer, I'm not writing codes, but I wanted to create a specific Google Word file that I can quickly customize, just not to, because there were some repeating words that I need to customize. And I just asked it to ChatGPT or Gemini to help me with this code. And I put in AppScript and it worked like magic. And I was fascinating, yeah.
So you mentioned that expansion, new markets, that's on the horizon of Dr. Yan. So maybe you want to share a bit more when we next meet, whether that's next year or sooner or later. Where is Dr. Yan in terms of new markets, new countries?
Yes, that's something I've been working on, I think, the past 9 months. So it's really hard to figure out what should be your next market. For many startups, it's always obviously US or Europe immediately. But in our case, it was not like that. So we needed a country where we have similar market situation, similar healthcare system. And I was looking into Central Asian market for some time. And then luckily, Alfredo introduced me to many people in Uzbekistan, and I'm very grateful. And once I started talking hands-on with people who know the market, they are in healthcare or in startups ecosystem, the picture immediately became much more clear than it was before that. Before that, I also had some calls, but these were very random people that I've somehow found. So right now we're very much focused on expanding into Uzbekistan market. We may have some small changes into the app. We may go there a little bit more narrow niche than we are in Armenia. But I'm very excited. I have planned a visit in the next 2 months, and we'll see how it goes.
Good luck and embrace opportunity. And with that, Irina, I can say it's been such a pleasure having you on the podcast. I think this conversation was really open and full of insights. So thank you very much for finding the time in your busy schedule, and best of luck for Dr. Yan going into Uzbekistan.
Thank you, Karlis. Thank you so much for inviting me. It's an honor and pleasure for me. I'm very happy we met during Plug and Play, and I really hope to see you again in Yerevan.
That wraps up my conversation with Irina. Let's take a moment to reflect on my key takeaways. First, problem-driven innovation. Irina's path to founding Dr. Yan exemplifies how identifying and solving a personal problem can spark the creation of a valuable business. Second, understanding your users. Irina's approach to segmenting doctors and tailoring subscription models highlights the critical importance of deeply understanding user needs. And finally, the power of perspective. Irina's experience with the plug-and-play Accelerator shows the value of stepping back to gain perspective with the help of knowledgeable mentors. Thanks for listening. If you enjoyed this episode, follow Irina and check out Dr. Yan to see how they are transforming healthcare access. And don't forget to subscribe to Beyond Sprint for more conversations with founders building meaningful change. Till next time.